Hi everyone, my name is Chelsea Brackett and I'm from Dothan, Alabama. I got my nursing degree at Auburn University. I went there for school, got my bachelor's degree, and then moved back home to work in the ICU here in Dothan. And I have been doing ICU nursing for 2 years now. And I moved into a CV ICU position where we recover open hearts, and I still do ICU nursing as well. And I went back to nurse practitioner school very quickly into my nursing career because I knew I always wanted to be a nurse practitioner. Going into school, I just knew that was what I wanted to do because I loved how nurse practitioners had nursing experience, but they were able to take it a step forward and use experience and schooling to develop these care plans for these patients and have continuity of care for these patients. And I really liked seeing that. And so that's why I decided that I wanted to go into nurse practitioner school and be able to work in an office where my patients are well, for the most part. And, we can work with them over a period of time to get their health better. Versus in the ICU, they're very, very cute. They come to you, you fix them, and then they go off and you never know what happens to them. So that's another reason why I went to nurse practitioner school, and I have had some great clinical experiences in nursing school, or in nurse practitioner school as well as nursing school. Auburn has done a great job with making sure that you get the clinical experience you need. So my first clinical experience was in an urgent care, and ideally, I thought that I would love urgent care because I was an ICU nurse and you see things that are urgent and quick, they just need fixing, and then you move on. And I decided after my clinical experience that I didn't like that. I liked seeing the patients over and over, having continuity of care with them, and really getting to treat these people over and over and developing a relationship with them. So urgent care was fun. You got to treat a lot of things. You got to see a lot of things. But after that, I realized, okay, I do like continuity of care. I do like taking time to really treat the patient as a whole versus just treating the problem that they come in with. So I then moved into an internal medicine clinic that has been absolutely phenomenal for me. The physician there and the nurse practitioner that I'm working with have been just the best teachers, and I have learned so much from them. And I also work at a hospital where they have residents and they have medical students, and so the nurse practitioners get treated a lot like medical students, which is great because you kind of get to learn how medical students are taught versus how us as nurse practitioner students are taught, and you really get to merge those very nicely and learn and develop rapport and develop relationships with these people that really help just teach you and educate you on what is coming up in your future. So I have thoroughly enjoyed internal medicine, and I am upcoming on peds and OB/GYN clinicals, and I'm very excited about that. So I'm very interested to see how I'm going to react in those and how I'm going to enjoy those. But so far, the biggest thing I can take away from clinicals is going in as an open vessel. And my analogy that I'd always use when people ask me how nurse practitioner school is going, and I always use that I feel like I'm just a vase, and the nurse practitioners and the doctors that I've been working with are like a waterfall, and the waterfall just keeps filling the vase and filling the vase and filling the vase, and the vase starts overflowing. And so that's how I feel that I have been educated so much in such little time by these doctors and nurse practitioners, that my knowledge now is just overflowing, and that is so incredible to see that you could be taught so much in so little time. So after nurse practitioner school, I feel like I'm probably going to move into an internal medicine or a gastroenterology or cardiology specialty, and see where it takes me. There's several opportunities where I'm at right now, and so I'm interested to see where those, will flourish and what opportunities I do decide to take. So I will be in a clinic somewhere. I feel like my days in the hospital are coming to an end, which I'm okay with. And I'm really ready for my own patients and just be able to treat my own patients and have some continuity of care with them. Thank you.